Hello, my name is Hubi Haji Mohammed. I'm an RN and I'm PhD candidate to Ottawa. And this is Public Health Governance, a paid board assignment in AP 5210, winter of 2021. So, do you remember I said you can go to the National Collaborating Center for Health Public Policy? So, if you go to their site, which is the link I shared in the slides, you'll be able to go to the description table, and in the description table is where you will see, so they have the provinces and territories or federal level, so you have all the provinces, and then they give you important departments such as Alberta Health, Minister of Children and Health, Minister of Community, etc., etc. I'm going to take you to Ontario, but you can explore in each. You can also see, so if you go to Ontario, they're going to give you Minister of Health and Long-Term Care, which public health comes under, Minister of Children and Community, and you have a Social Services, Minister of Education, Public Health Ontario. So these are important links of every province you happen to be or you want to do assignment on. You'll find important links. So let's click Minister of Health. Okay, so what is that? What happened? Oh, it actually gives you a description of it. So let's click. So it tells you the text includes section from the government website and official publications. So it tells you Minister of Health and Long-Term Care. What are they? Minister of Children, Community Social Service, Minister of Education, Public Health Ontario, created in 2007. Public Health Ontario is operational service. It explains you what it is. So I like the fact that they have an explanation of what they are. And wow, this is really impressive. Like, I honestly found this chart when at the end of the semester, which was a bit late, but this is one-stop shopping, to be honest. This is a one-stop shopping. And you see it has the organizational structure. You remember I was asking you to use organizational structures? So this is technically shows you how Minister of Health and Long-Term Care is structured. I love this, and I think you will really enjoy and have a peace of mind when you're doing the governance course, because you now you have one place where you guide it, and it talks about chief medical office, who is the chief medical office of health at that place, your responsibilities and reforms. Well, when did they happen? Amendments, and then they have preferences that can help you do more for any paper assignment that you're doing. So that was something I didn't know, and I'm glad I'm including it in my paid forward because I found it very cool, really. Regional level. So if you go to Ontario, you remember I was telling you about public health units, and so there's a public health unit and local integration network. You need to know public health unit collaborates with local health integration network, which now is going to be called Ontario Health Teams. So that one focuses more on a primary care, acute care, institutions, and populations that are transitioning on and off, kind of in that, like a downstream. Does that make sense? Whereas public health dealing with upstream. So when the two meet is to kind of collaborate together. Like, let's say diabetes is in the mandate of public health units to do diabetes prevention and health promotion. And when it comes to lean in Ottawa, we have the Champlain, which is our lean in Ottawa region, and leans can cover more than one health unit, by the way. So which covers Ottawa and other with closer places, proximity. They do screening. So there's something called Champlain screen. So they will be screening the diabetes reach hard to reach populations, or doing it with people who are disproportionately affected by diabetes, like immigrants, and they will be dealing with something that also falls under the public health. So it's like a downstream now. They want to know if these people have the disease so they can get the help they need at downstream. And normally screening has health promotion coupled with it, so that can be something they can say, okay, public health, you do the health promotion, etc., etc., we're going to focus on the screening. And that way then the referrals, then the clinics, then the diabetes education. There is a Ontario or diabetes education. Actually, there's a place that you can even call. Actually, I did a paper on diabetes for hard to reach populations, and that's actually how I learned about it. Because I thought I would find in public health, but then I realized the the healthcare system I needed to deal with that screening diabetes for homeless population was actually primary healthcare. So that was the healthcare system that I was going to involve in managing or diabetes screening. So those are the things. There can be overlaps and collaborations and stuff like that. So like something like COVID, definitely there's collaborations going on. There's people leaving the hospital who are sick, and so this is the continuum. So in that continuum, there's overlap definitely. So that's something I just wanna touch upon. Mm. Okay, so and then he talks about the chief medical officer of health, which is, I guess, this sheet. When you open it, once you open it at the top, it will walk you through this whole column, what's in it. So if I open, it doesn't matter, that one. Like it will talk about provincial levels, Minister of Health. It's like you're going down that slide, right? Minister of Education, and then talks about Public Health Ontario Public Health Standards. So actually, Ontario Public Health Standards is something that kind of, it acts, and it actually includes in my slides now, that the standards kind of create more specific guidelines, right? Whereas the the bigger act kind of delegates governance and roles and responsibilities and power and authority. That's what it gives. And standards is how to deliver health, public health, in a standard expected by Minister of Health and Long-Term Care. So there's public health unit. What is it? Explains to you what public health unit local integration network, which I just spoke about, is now changing to teams. And chief medical, yeah. So it will walk you down the road, and this is a good way to cross compare different provinces and what they have. Okay.